Well, Adam, I'm excited for today's guest. We're going to be talking with one of our classmates, Charitie Horsley, and the topic for today's discussion is how we can get beyond traditional healthcare models. It'll be exciting to hear what she has to say.
Yeah, Charity's awesome. She's got a great story, and I'm excited that she's willing to join us and share her passion and vision for healthcare. So it'll be great.
Well, let's jump right into that conversation.
Well, I'm very happy to welcome to the Class Patient Voice Amplified podcast our friend Charitie Horsley. Charitie, welcome.
Thank you. I'm very excited to be here.
Charitie, it's so great to work with you. And, you and I have worked together just a short time, but it's clear you have a passion for healthcare and you're very dedicated to the class mission. So it's been a pleasure to work with you in the short time we've been able to be classmates.
Thank you, Adam. I definitely have a passion, and I'm so excited about what we offer here at Class and what we can do to impact the world's healthcare. So you hit it on the head.
We get to do some very unique and special things, don't we?
Yes, so fun.
Let's talk a little bit about your healthcare career and your background there, and rewind from before your class days. How did you get to where you are today?
You bet. I'll go backwards a little bit. I like to say I'm well seasoned. I have over 26 years of actually healthcare experience now. Graduated in healthcare administration a long time ago, spent the first 14 years in rev cycle. So hospital and acute and ambulatory coding, billing, collections. I call it the dark side of medicine. But loved that. I'm a certified coder and auditor. I've done a lot of work with the AAPC and consulting in those arenas and speaking in those arenas. But I shifted mid-career kind of in healthcare to operations and really had a passion for ambulatory clinical operations. So about for another 12 years in that arena, where I managed large multi-specialty clinics. And then most recently, I was the assistant vice president for one of the largest healthcare systems, one of their divisions in physician services group, managing 50 practices across 3 states, Utah, Idaho, and Alaska, before I came to Class. So lots and lots of experience in ambulatory healthcare in all of the specialties.
So you've really had an insight to where a lot of us as patients reside and where we get a lot of our care. You've seen a lot of the inner workings there, haven't you?
Absolutely. And especially in my last role where I was for 6 years, I worked very closely with the hospitals and in the acute care side to make sure that those patients transitioned out of the hospital to our care. And patient care is really what drove me into healthcare from the beginning. So I'll start with that story a little bit, Adam.
Please.
But I grew up, I like to say healthcare is in my blood. My parents were both in healthcare a little bit. So my mom did administration, coding and information management and clinic management. And my father was a paramedic and then shifted into administration. But the dinner table discussions around my house all growing up were around healthcare, and generations back, we just all have a passion for it. And I just don't have the stomach to be a practitioner. Little things make me respond biologically. So I decided actually in high school that I was going to go into health law. And part of what drove that was my experience as a patient growing up. So both of my parents being in healthcare in a small town, we literally kind of had to be gushing blood from our, main artery before we were taken into the clinic or in to see a physician. But when we were, it was usually pretty serious and not a fun experience. And when my parents knew everybody at the clinic, and it just was never fun to go there because we were anyway, I actually, as a teenager, refused to go into the clinic because it was just never a fun experience for me. And as a junior in high school, got really sick with walking pneumonia. And got to the point where I was super weak and was coughing, keeping the whole house awake all night. And there was a new doctor in town. I'll never forget him, Dr. John Stout. And he was super kind, and he came to my house and did a house call and gave
Wow.
me the medicine I needed to get better. And that just wasn't common then at all. And so I actually was headed into health law. I had a passion for debate and political science to help physicians because I heard about all of the troubles that they had to deal with malpractice and government regulations and things like that. And in the middle of my political science and debate career in college, decided I could be more impactful going into what we call the family business in healthcare administration. And so that's where I pivoted. But my passion is around patient care. And what I would share with my teams is we want the patient's experience to be so great and so different from the other clinics that they don't even feel like they're coming to see the doctor, that they feel like they're coming to see a true friend who just happens to be an expert in their health. And so that's really some of the passion around patient experience that I have and how it was kind of formed.
About that a little bit, that's quite a task to get someone to feel like, oh, I'm just going to go see somebody that really cares about me, a true friend. What are some of the things you did to encourage that type of relationship?
Oh yeah, you bet. There's actually some little things you can do. So making yourself available when the patient can see you is one thing. So being available and open. So open access, I think, is a big driver. Responding to them, communicating to them, not making them feel like they are just another dollar or, just part of your busy day. I'll give you, even just this last week, I've had an experience where I sat in a physician's office for 45 minutes, and I'm not kidding you, spent less than 5 minutes with the practitioner. I just literally sat alone in an exam room for 45 minutes. And our whole process took 5. So I just feel like it's those little things that could change quite easily with good operations that would make the patient have a better experience. I also think proactive, preventive, whole person healthcare, getting to the root of the problem and caring about the person's connection to their mental health, their social health, all of those things need to be tied together to get healthcare to where patients are feeling more like they're important and they're valued.
Oh, I'm sorry you had to sit through that waiting room experience, or not even waiting room. You were in the exam room.
Yeah,
you
in
weren't
the
even in
exam
the
room.
waiting room.
Yeah,
Ah,
with horrible Wi-Fi and cell clip. It was horrible.
oh goodness. Sadly, I think too many of us have been there. We know what that feels like, and so my goodness, thanks for sharing that. Charitie, there's a couple of things I want to ask you about. Obviously, at class, we rate the technology that affects healthcare, right? Can you think of examples of technology that you've seen? And we don't even have to name vendor names necessarily, but just concepts. What have you seen that impressed you that could make healthcare more patient-centric?
Oh yeah, I'm so excited about this topic as well because I'm seeing, thanks to the pandemic, tons of progress here recently, honestly. But one of the big things I advocated for the past 15 years is online patient scheduling. Again, part of open access. Easier than getting on the phone and getting in when you need to be seen. Telehealth appointments for those things that you really don't need to drive into an office for is helping a ton. Having more accessibility to your records and your past history so that you have all of that at your fingertips on your mobile device. And then also what's exciting to me is seeing things like I received a letter in the mail yesterday from my local pharmacy that they offer cholesterol tests and diabetes screenings and being able to walk in with no scheduled appointment and no wait to get vaccinations at our local pharmacies. Those things, again, access and information and having it more readily accessible to patients and really allowing patients or giving them that power and the empowerment to own and manage their own healthcare is where we've got to go with that.
Yeah, I would agree. Those are great examples, and they seem like such good common sense. And we really get excited when we hear about some of those examples that are starting to grow a little bit. And you're not the first to tell us, hey, there's a silver lining of a pandemic, as weird as that is to say. But Thank you for that. And I would put all of those under the category of consumerism, focusing on the needs of the patient, the consumer. Can you think of any other examples that maybe you've seen today or you hear about just in general? Could be outside of healthcare, could be inside, beyond what you just shared with us.
Yeah, I mean, we could go on for hours, Adam, but one other exciting thing, actually two other exciting things I'll mention here as far as technology goes and where it's headed. First is continuous glucose monitoring, and now even more than continuous glucose monitoring devices, continuous multiple system monitoring devices that can keep track of where your blood sugars are, where your metabolism is. That technology is really advancing. And I think if patients really take the time to understand their body and how foods affect it and how environment affects it, I think we'll get a lot smarter about our healthcare. So I'm excited about that technology coming. And I also think that the study of our genetics and how different genes affect different drug metabolism and the way that they affect us. And, we're just getting smarter about the way that we treat conditions and how individuals react to different treatments. And I think technology and information is crucial there.
I want to pivot for a moment and talk about our patient experience improvement research that we're conducting. When Dan Check and I learned of your previous role and what your passion is on focusing on the patient, we came right to your office and said, okay, Charitie, how would you design this research? And you were so instrumental in helping us. So thank you for that. Any thoughts on patient experience and measuring that, and trying to improve that, either from your previous role or what you've seen since then?
Yeah, circling back to really the meat and my passion there, Adam. We're starting to see a little bit of a pivot to more of a consumer-driven healthcare. And I think that systems will have to start listening to patients as they get smarter and stronger. But as far as patient experience goes, beyond CG caps and some of the mandated surveys, we really need to start customizing our questions and simplifying our survey information from our patients, improving our engagement and getting a listening ear to all of the patient's feedback. And I'm going to tell you, this is difficult because it really varies by market and even within a market by location. So people don't typically travel very far for their primary care, at least, but even a lot of their specialty care, they don't travel far from. And in my experience, patients want different things. So for example, across 3 states, patients wanted different office hours. Some wanted early morning and evening, and some were fine middle of the day. Some wanted weekends, some didn't. I think what we've really got to get good at is listening to what the patients in that clinic's area want and need from our practitioners and our operations, both ambulatory and acute care, right?
Love that. Love that. That's so dialed into what I think a lot of the world understands already. You think of the only example I can think of, if I'm going to go buy a car, it's usually open when I'm interested and available, a simple process like that. So great insights.
Hey, Adam, let me add to that. I
Please.
think that you're seeing a real disruption right now with CVS and some retail healthcare saying we're going to be available whenever the patient wants and needs healthcare. And I think it's going to be disruptive, and providers have got to pay attention to that.
Yeah, I think you're right. If we can shop on Amazon in our pajamas, we can get healthcare hopefully in more convenient times as well. Where else do you think healthcare needs to go to be more patient-centric beyond what you've already shared? Any other thoughts?
Yeah, spending 26 years in healthcare systems in the U.S. And working side by side with hundreds, if not thousands, of physicians and practitioners, I do think there's still a lot of opportunity for whole person healthcare and preventive medicine and population health. And there's a lot of systems that just really haven't gotten good enough in those areas. So coordinating physical and mental health more seamlessly and working to find the root of the problem, whether that be gut microbiome or imbalances in vitamin deficiency. I just think we've got a lot of opportunity to look deeper with our patients, engage them in taking ownership, empowering them to take ownership of their own healthcare. We have a long way to go there.
Yeah, we sure do. Charitie, will you talk a little bit about your role at class, what you oversee, and some of the things you do every day here?
Oh, yeah, you bet. I love it, actually. So I'm the Director of Research Operations. I manage 5 teams who help gather all the 20,000 research evaluations that we get in a year. And so everything from the scheduling team who schedules the research appointments to the project team who works through all of the report and consulting delivery projects that we do, over 350 of those a year. I manage the executive researcher team, who are a team of researchers who are on the phone all day with excellent providers and contacts at our healthcare friends facilities. And then I manage a team of data processing who take the research interviews and transcribe and extract and edit those. So it's super fun to be right there in the weeds of getting all of our data and information here at class.
Awesome. Well, Charitie, any final thoughts? Anything else you'd add? This has been so helpful, and I love your perspective. I love the passion you bring, but any closing thoughts for our listeners today?
Yeah, I will add, Adam. I think that technology is coming a long, fast way, and I think that I would just say to anybody who is a patient, which is typically all of us, we've just got to get louder. Our voice has to get louder about what we want and need and what's important to us. And we've got to make sure we're sending that message to our clinics, our providers, our health systems. And so I'm really excited about patient survey information becoming more prevalent and that information being digested better and us more scientifically analyzing what the consumers want, which will vary by area, but is so important. So I really hope that everybody listening will take their health and their families and friends' health more seriously and really raise their voices. Participate in those patient surveys and add your comments. When I had to sit for 45 minutes and I got a text to participate in a survey, I let my provider know that that was not okay with me. We've got to get more involved and more loud about what patients want and need.
I love it. I will do that. I will make sure I fill out my next survey that comes, and I think that is a good way to share. So Charitie, thanks a million. This has been fantastic. I love, like I said, your passion and insights are so helpful and really added a lot to us today. Thank you very, very much.
Thank you, Adam. It was so fun. Let me know if I can help again.
Okay, thank you.
Well, Adam, that was a fun conversation with Charitie, and it was good to hear about her early childhood experience that led her on a lifetime of patient centricity. What stood out to you from the interview today?
Yeah, I'm really touched by the effort of a clinician to reach out and deliver that level of personalized care. And like you said, it really set her on a course of passion in healthcare and improving everything around us that impacts the patient. And no wonder she's such a great employee at class. That fits our mission precisely, doesn't it?
Yeah, sure does.
I really appreciate that Charitie is so willing to jump in and help us with our research. She brings such a wonderful perspective about patient experience improvement. She's helped us on our research questions and how we should think of that. And it's all driven by this passion. So it's great to have her as a classmate, as we say.
Yeah. Well, Adam, why don't we jump in and we always like to share a research minute, something we're hearing on in research studies that we're doing. What's something that's come across your desk recently?
This was a week where we reported back to vendors in a couple meetings what their customers are saying. And the reason I share that, it's a little bit different take on a research minute, but we had a chance to share that patients have a need to get help on technology. And luckily, we had some examples where these vendors were actually helping and offering support directly to the patient. And that may not sound like anything super innovative, but compared to other examples out there, compared to the need and the reason we want to focus on patients, it was great to have a few examples to share back with them. So I know there's examples out there of people that care. They're trying to include the patient more in all their efforts. So that's a little different take on a research minute, but I thought I would share that with our listeners today.
That's fascinating.
How about you? What's something you've overheard you want to share with our podcast listeners?
Just this morning, Adam, I was talking to a CMIO at a large academic medical center, and we were on this, having a conversation about digital front doors. And I asked, one of the very last things I asked was what advice this CMIO had for others who were looking to kick off a digital front door program and build their strategies. And it was very interesting. I thought this was perfect for our podcast today. He shared with me the only really one big piece of advice, and that is to put the patient first. It isn't about the technology. It's not about the processes and the people. It's really about the patient. And if you design the program around the patients and what they care about and include their voice, then your program is going to be successful regardless of the technologies used.
That's great. Love to hear that. That's so needed in healthcare. Thanks for sharing that one.
You're welcome.
Well, can I offer a quote as we wrap up today's episode?
Yes, always excited to hear this.
Okay. Today I have a quote by Steve Jobs. He said, "We think our job is to take responsibility for the complete user experience. And if it's not up to par, it's our fault, plain and simple." The complete user experience. That's not just the providers. It has to include the patient. And that kind of fits nicely with your piece about what you've overheard at class. So
yeah,
we've got to focus more there. Dan, thanks again. Shout out to Charitie Horsley. Always enjoy working with her. And thanks for listening. We're excited to share more as we amplify the voice of the patient.
Before you go, don't forget to hit that subscribe button so you never miss an episode.
If you like what you're hearing and are getting some real value out of this podcast, please share with your fellow healthcare leaders and friends.